Here you're watching coblation tonsillectomy in an 11-year-old child with obstructive symptoms. But since the tonsils are very large and she's already 11, we plan to perform extracapsular tonsillectomy. I'm using Smith and Nephew plasma coblation at the setting of 7 for ablation and 3 for coagulation. I'll try to be absolutely within the boundaries and I'll make sure that I do not open up the muscles so that the child gets least amount of pain and bleeding. Alright, so that's the correct plane. You can see muscles are not yet exposed, and I'll keep my dissection in this plane, only dividing the connective tissue between the muscles and the fossa, and all those small vessels have coagulated. That's the lymphoid tissue. Alright, so I'm just dividing the connective tissue fibers between the lymphoid tissue and the muscles. And see here, there's a cotyledon going inside. So I'll try to use a small vessel. You see this? I'm coagulating that vessel. This is the lower pole already. At the lower pole, I have to be careful not to open up the tonsillar artery. Let me first open the tonsil like a book. Right from superior pole to the inferior pole, it's opened like a book. Now, there's a small vessel over here. I would expect the tonsillar artery to enter the tonsil somewhere here. I'll go little intracapsular just to make sure that I do not open up the main trunk of the tonsillar artery. That's called hybrid tonsillectomy, my own technique. And here I'm not leaving behind any significant lymphoid tissue, just keeping a dressing over the tonsillar artery. That's it. Now, just a little bit intracapsular at the lower pole without leaving behind any significant lymphoid tissue. Now, see, there's a little bit of exposure of the muscle here, which was inevitable because it's an 11-year-old child. Tonsils obviously have become a little more deeper. this small exposure of the muscles, we have to understand that there'll be a little pain on swallowing, but there'll be practically no bleeding and not much pain. This is the lower pole already dissected, and there's no exposure of the muscles in this area, only a little bit exposure here, where it is absolutely stuck to the fossa. As I said earlier, I do not want to leave behind any significant lymphoid tissue for recurrence. Now you see, all right, so only this much, half a millimeter dressing over the tonsillar artery. That's it. Certainly, there is not going to be any recurrence at all, and the surgery is going to be almost painless and certainly bloodless. All right. Let me try to show you the fossa. All right. Thank you for watching.